We have three of us. We have three of us presenting today, and today we're going to be talking about launching a successful virtual abortion values clarification and attitude transformation workshop at your institution. My name is Sarah Hutto, and I am from the University of Minnesota, where I'm a clerkship director, and I'll let my co-presenters introduce themselves as well.
Sure. So I'm Laura Jacques. I'm an OB-GYN at the University of Wisconsin and also the clerkship director. And then Elise.
Hi, I'm Elise Cowley. I'm an MD PhD candidate at the University of Wisconsin-Madison in the PhD portion of my training. And we're asking for your emails right now so that we can send you a form that you will use to participate in this workshop. Amanda?
Hi, I'm Amanda Wildenberg with University of Wisconsin-Madison, and I run the tech for the Wisconsin sessions.
Excellent. Thank you so much. So we'll move on to the next slide. We don't have any disclosures for our presentation today. Next slide. So like we mentioned, please do list your email in the chat for us so that we can send you a worksheet that we'll be using during our simulation of the workshop later today. All right. So our learning objectives for our session today are to discover the importance of values clarification and attitude transformation workshops in medical student curricula, to practice how to deliver a 1-hour virtual abortion values clarification and attitude transformation workshop, which we'll shorthand to VCAT today for medical students, and to analyze potential obstacles and solutions to implementing a virtual VCAT workshop with medical students at your institution. Next slide, please. So just to provide some background about the Four Corners VCAT workshop, it is an activity that is recommended by the WHO, which allows for providers and learners to really differentiate their own beliefs surrounding abortion care services from possibly patients who are seeking that kind of care. It also provides an environment that allows for participants in the workshop to discuss and even defend views that might be different from their own. So to kind of describe how the typical in-person session goes for the Four Corners workshop, Four Corners essentially means the four corners of a room. So when you're doing this in an in-person visit, you basically print out different sheets that have 4 options on it, which are strongly agree, agree, disagree, and strongly disagree. And then what we do is we have the participants fill out a form that has 12 different statements on it. And there are actually 2 forms that they receive, and one that they fill out with their beliefs surrounding their the access for abortion care services for all people. And then the second worksheet they fill out has to do with them saying their beliefs surrounding abortion services for themselves. And then in the real person session, they kind of will look at those worksheets side by side and see where there are differences and similarities and kind of consider why those differences exist. But then after they do that, they take one of those, the form regarding their beliefs surrounding abortion care services for others, and they crumple it up and everyone throws their form into the middle of the room. And then each participant goes and selects a random form from that pile of paper. And then we read each statement, and each participant has to go to the corner of the room with the answer that is consistent with the view that was held on the anonymous form that they picked up. And that view on that form could be different from their own. And then we go around the room, and each person group kind of explains why people might feel that way surrounding that statement and respond the way that they did. And it really provides an environment to encourage and defend considerations of all the varied views surrounding the statements. Next slide, please. So obviously with the COVID-19 pandemic, in-person learning restrictions really increased. And so we viewed this as an opportunity to develop a virtual format to complete this workshop at our different institutions. And like we mentioned, this was a multi-institutional kind of project done between our 3 Midwest institutions. Also, the other important thing to consider is with kind of the declining access to formal in-person abortion training opportunities, this really virtual option can fulfill a deficit in curriculum access surrounding abortion care in any kind of setting. And so we were excited to get this together and allow it to serve as a method of teaching abortion care kind of from anywhere. So next slide. And if you are just joining us, please do put your email in the chat so that we are able to send you a worksheet that we're going to be using for our simulation portion of this presentation today. Thank you. So as far as the virtual workshop content, the way that we pivoted this was prior to the workshop being completed, we had the participants or our learners, which in this situation were third-year medical students on their OB-GYN clerkships, complete the two forms that we discussed. And Form A is about their personal beliefs about abortion services for others, and Form B is about their beliefs for themselves. And so they did this as pre-work prior to the workshop, and they were submitted back to us. And then prior to the day of the workshop, we would then send out anonymous Form A's for the students to learn during their workshop session. And we then had each student answer polls in the virtual session that reflected the response on those anonymous sheets that were sent to them. And then we would take some of those opportunities to have breakout sessions to really further discuss the statements. And then at the end, provided a time for reflection. And so we're planning on simulating that today. And I'm going to pass it off now to Dr. Jacques, who's going to talk about the technological side of this project.
Thank you, Dr. Hutto. Hi, I'm Laura Jacques. I'm the clerkship director at University of Wisconsin-Madison, and it looks like we have Dr. Dean and Dr. DeGroff who have joined us, so thank you. So the way that we have run this is before the workshop, everybody gets in their email a Form A and a Form B, which Dr. Hutto just explained. Form A allows you to rate from strongly agree to strongly disagree how you feel about a variety of different topics around abortion. So things like abortion services should be available to every person who wants them. And then you would say you either strongly agree or strongly disagree. Form B differs in that you start thinking not about what other people should do, but how do you, or if you're somebody who doesn't have a uterus, somebody that's close to you, how do you feel about that care for yourself? So you really get a chance to think about your differences when you're thinking about the population at large and patients at large versus for you or your family. And next slide. And so once you fill that out, then what happens is we are then able to receive those emails, and we put a code in, and that code then takes all of the emails in the spreadsheet. So we have a spreadsheet, everybody's emails, responses go in there, and that code will then send it out to one of your classmates so that they get an anonymous response in your email. And if you're just joining us, if you could go ahead and share an email that you would like to use for the session, either to everybody, or you can send it just to Elise. We are going to demonstrate for you what this process is like. So Elise is collecting these emails, and then she's going to send you an anonymous version of a worksheet filled out by someone else. So the way we do this, if you remember in the in-person four corners, just to catch up the couple people who just joined, it's a process where there's four corners of the room, agree in one corner, strongly agree, disagree, strongly disagree. And the students will fill out, or the trainees will fill out the 12-statement workshop about how they feel about abortion. And then they'll crumple it up and throw it into the middle of the room. And then they'll pick up one of their classmates' sheets and then respond to the series of prompts going forward based on the viewpoint of their classmate, not themselves. So those 12 statements are things like, I think that patients who have an abortion are ending a life, and they'll either strongly agree or strongly disagree. And what the facilitator does is reads those statements, and then the students move from corner to corner based on their responses. But the beauty of this for medical students is that they're not responding based on their own belief system. they're using that worksheet that they picked up from the middle that's one of their co-students' belief systems. And that helps in a couple ways. It allows them to be able to get into the mindset of someone else. And when we've been running this, one of the things that we've noticed is it's actually really hard to predict how people are going to answer. Like, I thought, honestly, when I read a sheet based on how somebody answered abortion services should be available to every person who wants them, I kind of thought I could figure out how they would answer the rest of them. And it's really surprising how much variety there is in the responses, even within one sheet. So it really allows people to think through the nuances that come with abortion and abortion stigma, and to be able to talk about it in a way that kind of takes the heat away, because they're not expressing their own views in the workshop. They're going to be working from an anonymous person's worksheet who just happens to be one of their classmates. It also helps classmates hear, what does it sound like when one of my co-classmates is representing my views? So what we had you enter your email in the chat, because we had to sort of simulate this virtually because of COVID. So we switched to this platform. And what happens is we will send you in your email a worksheet. And these are actual worksheets from our students that are de-identified and anonymous. So you can get a sense of what that looks like. And Elise is doing this live, just like we do in our actual sessions. So we have a code that one of our undergraduate students was able to create for us that will randomize, and that we'll share with you, that will randomize responses and send them out so that students would get in their email the responses. So it simulated that, snowball exercise of throwing things into the middle of the room and getting an anonymous response. Okay, next slide. So the workshop itself then is all done on Zoom or whatever virtual platform you use. It could be adopted to any of them. Everybody's in their own spaces, and they will be working off of the worksheet that they received in their email. Next slide. So we are going to simulate this. We're going to enter the Simverse because it's actually really simple, but as I'm speaking, it can be kind of complicated. So many of us found when we were running this that we really had to just get in there and do it to really understand how the workshop works. So if you are a participant, you should go ahead and check whatever email it is that you sent and see if you received Form A, and then pull that up, and you're going to be responding from that worksheet, not from your own personal beliefs, to a series of prompts that we're going to send you in a minute. So please type in the chat if you have not received Form A. Okay, next slide. So when we start the workshop, we welcome everybody. We let them understand that the purpose of this workshop is to understand how other people think about abortion, to better understand how we think about abortion, so that we can care for patients optimally. And the goal is to create a safe space so that people can talk comfortably and without fear of humiliation or reprisal. Next. So we give the objectives, which I just explained, which is articulating the beliefs about abortion, defend and respectfully explain to other, sometimes conflicting points of view, and explain the different values underlying a range of beliefs on abortion. So next slide. And so what we're going to do, we're going to present a statement from Form A, and then you're going to respond via a Zoom poll what the response is on the sheet that you have in front of you, not your own beliefs. Those actually won't enter into the workshop at all today. And the responses that you have are from actual medical students who have participated in our workshop. Okay, next slide. So we'd like you to respond to the statement again, not as your own thoughts, but as the person who filled out the sheet. So next slide. So number one, so we're going to practice the polls. Abortion services should be available to all patients who want them. And again, respond not as yourself, but as the person on your sheet. And so when people do this, this also allows everybody to see often what the heterogeneity is of beliefs within their group. So they can really get into the minds of the person whose sheet it is that they're filling out, but also they can see that there's a variety of belief systems, even within a group of relatively similar people, medical students of a certain age in a certain region. And that kind of lets them understand too that, you know, there's ways of thought. Okay, so then next slide. So then you guys can all see the poll, I think, right? Beautiful. Okay. So then we go on to the next statement, which is patients who have an abortion are ending a life. And we go ahead and put up the slide. And this one we noticed there's, again, I sort of thought I'd be able to predict how people would answer based on the first, how they answer here. So as you're filling these out from real medical students, it might be interesting for you to see that you may not be able to predict how this student is going to respond to each statement, even though you might think you are. Okay, next slide. So a patient should be able to have an abortion even if their partner or spouse wants them to continue the pregnancy. And then we go through these, and again, people are kind of getting into the mindset, understanding like how this person thinks. And then we choose a couple of the statements to have small group breakouts. So we will break them out into agree, strongly agree, and then disagree, strongly disagree. And they'll be responsible for coming up with why they think that the person who filled out their worksheet thinks the way that they did about that statement, and some rationale. So a little deeper than just seeing that they think differently. Now they're actually digging into it and thinking about why they might think that way, and then articulating that to their classmates. Next slide. So liberal abortion laws lead to more irresponsible sexual behavior. And these statements are put out, you know, for those of us that are just joining, not by us, but this is a workshop that was created by IPAS, so it's an internationally used workshop. So many of the statements are very vague, which is intentional to allow for a variety of thought around the process, around the question and statement. Okay, next slide. Young unmarried patients should be allowed to have an abortion if they want one. And the way that we pick the breakout groups often depends on the responses. So when we send out ahead of usually the day before the workshop, we send out the forms for people to fill out, and then we send them to the anonymous emails through the code. And then we get Google generates a graph of the distribution of responses for each one of the statements. So then we look ahead of time the day before and we say, okay, you know, statement 5, there was a lot of heterogeneity, so we ought to use that one as a breakout group. Or there's some that if we don't have time or people don't fill it out soon enough, there's some that we know are always going to be a lot of heterogeneity. Like I think the next one coming up, number 6, is usually one that we use as a breakout. What's the next one? Yeah, so clinicians who specialize in OB-GYN have a responsibility to perform abortions. So this is one where we usually have a lot of heterogeneity. We've run this with medical students, with OB-GYN residents, pediatric residents, family medicine residents, and this one often there's a lot of disparity. So we always use this as a breakout. So we're going to simulate that breakout group now. And what we'll have you do is just join, if your worksheet says that you either agree or strongly agree, then you're going to join group 1. And if your worksheet says disagree or strongly disagree, then you will join group 2. And then we have each group will talk about for 2-3 minutes. You'll talk about why somebody might agree with the statement that clinicians who specialize in OB-GYN have responsibility to perform abortions, or why somebody might disagree. You're going to choose one facilitator, so somebody who will help guide the discussion, and a reporter, so somebody who takes notes. And when we're running this with students, that is like a key thing to do, because otherwise you put them out there and then you want them to report back to the large group and nobody's taken notes. So like they must assign a reporter. And then you guys will talk about it, and then you'll come back and we'll hear why each group thinks the way that they do. So Amanda, who runs the tech for us when we do these sessions, has cut and pasted the content from this slide into chat. And a key just tech point is it's really helpful if you have a Word document with all of your questions so that you can cut and paste from the Word document because you can't get it from Zoom or PowerPoint. And you also have to paste it into the chat before they go into the breakout rooms. Because if you try and paste it into the chat after they're in the breakout rooms, they can't see it. So these are just some things that we have learned over the many iterations of running this session. All right, so if you can now, let's see, join the breakout groups, you'll see that there's 2 rooms, and hopefully you'll be able to see that you can join either room 1 if your person agreed or strongly agreed, or room 2 if they didn't. Do you see the ability to join a room? Beautiful. Okay, great. And then if you can't, just let us know and we can assign you to a room 2 if you don't see where to join. Okay. And then guys, Elise, maybe we should join the rooms. What did you guys think about why clinicians who specialize in OB/GYN do not have a responsibility to perform abortions?
We both have complete and total recall, so we did not assign a reporter. So
that almost always happens the first breakout group. People like get into the hang of it once we get through. We usually do 3 breakout groups, and by the end they've got it. But it almost always happens initially.
Yeah, but using my complete and total recall, I can tell you that what we discussed was how interesting it is to assign an identity that you may or may not agree with, because it really forces you to think why that person may have that belief, and not just understand that they do, but think of a rationale that makes sense to you as to why they would have that belief or understanding. And so the example I gave was I don't perform circumcisions, and so I don't feel like I have a responsibility to perform a circumcision, but if a patient asks me to, I'm going to refer them or provide them with the access to that care. And same thing too, as an obstetrician, if I don't perform abortions, perhaps that's fine, but I need to be able to provide my patient with the care that they need. And Elise was pointing out that in many of these discussions that brings people to constructing better logical arguments as to what their own beliefs are. So kind of a values clarification exercise, kind of putting some words in Elise's mouth there.
Yeah, exactly. So, maybe OB/GYNs don't have to provide abortions. An example for that would be not everybody does circumcisions, but because it is a medical therapy, then people should at least have a responsibility to refer to somebody else who can provide that care for the patient. That's exactly the thing that we hear from a lot of different folks. And sometimes they bring up, there are physicians who may not do it often enough, so they may not have the skill set. They can't maintain such a wide breadth of surgical skill. For example, they will use like surgical incontinence procedures. Not everybody does that. So that's another thing that people will talk about. And then our group, people are tired of hearing me. Dr. Dean, do you want to say what I wrote down, but I don't know that I want to say. I'm still talking. Do you want to report out what we thought in our group?
I can report out. I didn't write it all down, so I'm not quite sure. So one of the things we talked about is that it's a necessary service that, providers should provide if requested. And one of the reasons is in certain areas, there would be a disparity in care, and that there may not be providers readily accessible or available to take care of it. And we have a responsibility as our profession to provide these services to people who are not able to get them due to the availability that's in there, and you will create undue burdens and not successfully provide what should be theirs by right. The second thing that we were adding on but got cut off on was that there will be complications that will develop when unlicensed providers start providing these services in absence of a licensed, trained provider who will do it in a safe way. And it is our responsibility as a profession to prevent these things from happening.
That's right. If not us, then who? So those were the kinds of things that we talked about. Yeah. And those are the things that people bring up when we run this session too. And it's amazing. We've run this session, I don't know, so many times, maybe 50 times or something. And people have such a wide range of thoughts. Every time we run it, somebody comes up with something in one of these small group breakouts that I hadn't heard before. It's really been enlightening and really inspiring to hear people be able to dig deep on both sides of each statement. Okay, next slide. So that's how the session goes. There's a total of 12 statements, and we run through those, and usually, and we'll give you a time breakdown in a little bit, but based on the length of time that we have allotted to this session, which we can run in as short as an hour, and we have run in as long as 2 hours, we pick a different number of breakout sessions because we really want to be able to get through the entire thing. At the end, we do a reflection. And the reflection is a key part of the workshop. So we want to make sure that we get enough of the small group breakout rooms, but enough time for reflection at the end. Next slide. And people reflect on what it was like to represent beliefs about abortion that were different from their own. What was it like to hear their beliefs represented by others? What rationale for certain beliefs caused you to think differently? And some people actually think differently after this. We have data to show that. What are your general impressions about the beliefs held by people in this room? And did that change after you went through this workshop? And then how do we think our beliefs about abortion affect societal stigma or acceptance of abortion and patients' ability to access that care? And that is a key part is, we talked about how important it is to get in the mind of somebody else, but then they also need that time to really think about what that meant for them. Next slide. So now we're going to exit the Simverse. So we're leaving the simulation of the session, but that's basically how the session runs. And it's kind of like this, where it starts out like people are a little bit unsure of what they're doing and maybe it's kind of lame, but then they get into it. And by the end, people are having really robust conversations and sharing. And I've been incredibly impressed with all kinds of different learner levels, how engaged they are with the session, even in this virtual Zoom space. Next slide. Okay, so I'll turn it over to Elise now to talk a little more in detail about how the nitty-gritty of the sessions go.
Okay, and I put it in the chat, but you can see what all 12 statements, what each of them say in your emails that we go through throughout the workshop. So I'm going to touch on a few considerations if you do run this workshop at your institution. So Dr. Jacques mentioned this at the beginning. We recommend reviewing the data for Form A ahead of time and picking statements where there are more disparate answers to increase a likelihood of a good discussion. So if you do this in a Google form, you can easily see the breakdown, and there are some pie charts here showing that. And we typically do see the same questions have the most disparate responses, but occasionally you will have a group that throws you off, and question 2 is more disparate and you don't normally see that. And so being able to roll with that and change which questions you decide to do as breakouts is helpful. Next slide, please. Okay, so we were going to do one more small group breakout and of how you guys might implement this at your institutions, how you might incorporate this into your curriculum. What levels of learners would you run this workshop with? What obstacles could you foresee with running this virtual workshop? Just running it virtually or running it at your institution. So I think we just have Dr. Jacques.
Yeah, we just have 3. So let's just talk about it as
all together.
We are a small group, let's be honest. We are our own small group.
So does anyone have any thoughts on any of these?
So I guess I live in Boston, so a fairly blue bubble. At least in our residency program, I don't know that there would be a lot of distribution of beliefs across most of these questions. I think in our students, there would be more distribution. So I don't know that I would necessarily run it with our residents in this format, simply because I don't think we'd get that richness of discussion. But I could see it running with our medical students. And same thing too with our faculty. Our faculty are pretty much all of one mind, as far as I know. I
It's
think I'm
interesting.
pretty sure about my residents.
Yeah, I think that's probably true for some residency programs where you do have a lot of people self-choosing into the program because it tends to have access to family planning training and things like that. But this is something you could even run. You don't necessarily have to be an OB/GYN residency, right? You could do this with family medicine residents. You could do this with internal medicine residents who are going to see, people who need to access these services, and to give them kind of some perspective as well. So it really can branch out of the OB/GYN scope, which is something that is really exciting.
That's a really great idea.
And we've had some fun. So we've run it University of Wisconsin, Minnesota, Medical College of Wisconsin, and Aurora Sinai. And our residencies are actually really pretty pro-choice. And the way that we handle that, because there's still benefit to doing it, it's not as deep because there isn't as much disparity within the group, but there will be disparity, and that'll be interesting and surprising to some people. And like I said, even within the questions, there'll be disparity in the strength of people's beliefs. Even if they agree, some might strongly agree, or some might agree a little bit less. So there might be the opportunity to explore that. We've also just randomized people. So after we look at the poll and we're like, okay, everybody here really strongly agrees with this, but let's get into the minds of somebody who doesn't. And then we just assign people to go to the disagree group, and they have to think then critically about how somebody might think that way. So, and there's benefit to that. We ran it with our residents, and they were almost all, their attitude, like, were very positive towards it, but they still really enjoyed the session and felt that they gained something from really getting into the minds of somebody else.
Awesome.
What do you guys think about obstacles? Or yeah, go ahead, Dr. Dean.
I was going to say, I mean, we're a small residency program, and we're community based now, joined with Mount Sinai in New York, but we're still out on Long Island, and we do not have there a family planning rotation. So the residents who are interested have to choose to rotate out for that. And we have a couple who do, but most don't, because they have other rotations if they're going to do something out that they want to do. So it's not a dedicated part of the program other than didactics. And then in addition, we have, a variety of providers, ones who do and ones who don't. And I'm not sure. I think the residents almost have choice of whether they attend or don't attend those. I don't think they're required to. There's certainly ones very interested, motivated, both, ones, like for educational, but also for advocacy type of attitudes. And that makes it a very interesting thing to run there, because, I don't believe it's required that they attend. But, I mean, it's just something to think about there. And I'm not even sure how I approach it from here, but, it's an interesting conversation.
Yeah, and I don't know what you guys, like Dr. Royce or Dr. DeGroff, what you might think about that issue, if you have any thoughts. I can say, I think when I hear it, I think, oh, that would be really fascinating. That's actually exactly the kind of program that we hope to be able to reach with these virtual VCAT sessions, are places that maybe don't have family planning faculty, because you could get a family planning faculty to run this session with your residents, and it would be really interesting to run it with your faculty too.
Yeah.
If you ran it together with residents and faculty. And you can't always honestly do that with a standard VCAT where people really have to put their own views forward. But in this way, where you can see what everyone's views are, but you are not vulnerable in that way that you have to share yours, it could really allow for some fruitful discussions in that sort of a mixed trainee level and faculty level group, and allowing for a facilitator who's not from your institution but is trained in providing these might help people feel comfortable too, because it's a facilitator they don't know. So that might allow for, even more rich discussion. I think it would be a really cool platform for that kind of setting.
Would you be more a facilitator who does family planning or a facilitator who runs VCATs?
Most people that are family planning trained have done these VCATs, but you don't have to. Anybody can run this session. The facilitator guide is really specific and detailed. The family planning people help just because they've done a lot of work around stigma, but it certainly doesn't have to be. It could be anybody. Dr. Royce, what were you thinking?
Yeah, I'm sorry, I came in a few minutes late, but has this been trialed in lay people and people outside of medicine as well?
Yeah, the original, well, not outside of medicine. It's mostly used in health providers. The IPASS curriculum was created and used by the WHO for people who are going to be providing medical care in some way, not always physicians, across the globe. So some of the questions we tweaked just a little bit, statements, because they were not at all applicable to the United States, but it has been run in a really wide international audience. But it's an interesting idea in just general society, whether or not it would.
It really is, right? Like, it would be interesting to hear what just, a bunch of people taken off the street think.
Really interesting. Yes. And see what kind of, that's an area. So when we ran it with our medical students, we were able to see over the session for at least a short period of time that there was an increase in positive attitudes for people that have done this, and people that started in the most negative quartiles for attitudes had the largest gains. And so I think that if you applied that to the general population, where there's going to be an even wider disparity, because still there were quite a few accepting attitudes, I think you'd really see the potential to move the needle. It's a great thought. Any other thoughts about obstacles in implementing something like this at your institution?
The usual time, money, staff.
Yeah, like Dr. Royce, you were thinking about your students. Do you work with the clerkship, or what's your role where you are?
Yeah, I'm the director for UME for our department, and I'm the clerkship director. But I do a lot. I do like the ambulatory practice for the residents also. So there's a lot of, pitch hitting that happens across the UME GME border.
Yes.
And it would be really, I am fascinated by the idea of running it with faculty and residents together.
Mm-hmm. And how do you think if you're thinking faculty and residents, how do you think they would respond to doing something like this?
So we're very lucky. Our culture is that everybody comes to Grand Rounds. So there would be a platform or a location time for it to happen. That's just our culture is that everybody comes. So it wouldn't just be residents. I think, yeah, it would be really interesting to try it. I'm intrigued.
Elise, you want to go into the next? So I want to talk a little bit have Elise talk about some of the obstacles that we ran into, just to give you an idea of some things you might come up against.
Yes, so you've touched on a couple of the obstacles that we've come up against, but on a few of the others. So timely completion of pre-work. So they have to fill out Form A before the workshop, and we have to be able to have time to randomize it. And so normally we do that randomization a little bit before the workshop starts, just in case if there are any tech problems, we have actual time to address it. So having medical students actually complete that pre-work without too many nagging emails can be a bit challenging. And there's always technology hurdles with everything virtual that we've all encountered ad nauseum over the last 2 years. And some that were already highlighted by Dr. Jacques. And just to summarize them, statements. So the statements that you're going to do in the breakout rooms can't be seen on the slides or in the chat when they go into breakout rooms, unless you copy and paste it into the chat beforehand. So having a document open with all of those statements to easily copy and paste, and Amanda created that. And so she's very quick on it, and it's like seamless now. and having more than one person to facilitate and run tech. It's very challenging to facilitate and try to get students to engage and participate, as well as trying to run the polls. And so across all of the institutions that we've been running this at, there are two people. There's a facilitator and then someone that runs tech. And we're very fortunate that we have Amanda on this workshop right now who runs all the tech for UW and is running the tech here. And she's instrumental, and you would never know that there are tech challenges if you have someone like her. And also, if the answers aren't disparate, having to randomly distribute students and being able to do that on the fly and notice, hey, this poll isn't that evenly distributed. So rather than going into the breakout rooms yourself, we're just going to randomly distribute you. Then student participation in a virtual platform can sometimes be difficult. And sometimes you have groups that are really willing to share. And sometimes you have groups that everyone wants to keep off the camera. And, they have a shelf exam in 2 days and they are just not having it. And so trying to really encourage students that it's a safe space and it's 1 hour and to participate and share is really helpful. We've had some students.
And I'd say, Elise, wouldn't you say, like, by the end, they may start out with their cameras off and like pretty quiet, but by the end, most of them are getting into it. I think the content like drives participation.
That is true. And then having the opportunity, going into these small groups where there's only a few of them and it's their classmates and they know people, they're on rotations with them, and then coming back to the big group. And so sort of having that, I think, also helps with participation rather than just asking people in the big group on Zoom, hey, can anyone share why you might agree or disagree? The small groups, I really do think help. We've had students who want to opt out of the abortion content curriculum, and also students who are concerned about the anonymity of the Google form. So making sure that it's very clear that the only person that sees that email address that's linked to the form response is the person doing the randomization. And we are only seeing that they filled out a form. We're not looking at their answers, and that their classmates will not receive their email attached to it. And determining the length of time of sessions. So we typically run these in 60 minutes and 1 hour. And so having 2 of the statement breakouts and then the 1 reflection at the end can work depending on how willing students are to participate. If you have an hour and a half, you can do 3 breakouts. And if you have 2 hours, you can do 4 breakouts. Next slide, please. So we've also touched on a few of the future steps we're thinking about with this project a bit. So we've been running this across 3 institutions with medical students for a year, and we're evaluating the impact of these workshops on medical students. And if you're going to APGO CREOG, please come visit our presentation and our posters about this. Also expanding this to using this workshop for Ob-Gyn resident learning and trying to expand it to other resident groups. And of note, I did present this at a lab meeting, and people also did bring up, have you thought about running this with lay people? I think the challenge is you definitely have to have money for that, because to recruit lay people to participate in this, you want to get an unbiased sample. So you need to have pretty good funding to do that. But I think that is really interesting, and how we've seen this move the dial in med students really opens that up. But any interest in like working on this project or collaborations, feel free to reach out to us about it. And next slide, please. So we thank you guys for participating and for joining this workshop. And this is a QR code. If you scan it, it will take you to a box folder that has access to everything you need to run this workshop at your institution. And if you have any questions about implementing it or any questions about the curriculum, you can feel free to reach out to any of us on this workshop. And if you have any questions, please feel free to ask them now.
Elise has done a really detailed job of the Google code part, because that part was very intimidating to me, but she has screenshots. It's like very clear how to run the randomization code. I'm very technologically challenged, so she created it in such a way that even I can understand it, which means that you will be able to.
And we've had everyone at other institutions at MCW as well at Minnesota. We've had people run the code. And when I went on vacation for a brief while, Amanda also ran the code as well. And I ran her through it in a Zoom session. And I think it worked well.
And if you want a facilitator, I'd be happy to facilitate too, if you want somebody random from another institution, and we can help run the tech. If you if you need that, let me know. I'd be more than willing to do that. Like Dr. Dean, I'm so excited for it to happen at your institution. I feel like it's the perfect place.
I'm going to say that there's a lot of resistance to everything in my place. so I.
How do
Yeah.
you think? I want to hear about that. We've got like a couple minutes. How do you think? What do you think might get this through, or why do you think it's important for your group?
Well, I think that the format for a lot of things would be important. My issue with the group is we're a relatively new residency, and the core faculty is primarily made up of clinical practitioners. We do not have people who are medical educators in general. There is a way to do things, and it's my way, is something I understand is the most common attitude. Our chair is very good, very bright, very active, but not so much has delegated all the administration to the program director, who is, just obsessively in control of everything. And it makes it difficult to do any change because it has to accept that it's going to work. And so there's a lot of, there is a time to strike, and I already have a couple of things working on that, because we recently had a survey that just put a lot of dissatisfaction from the residents at the type of teaching, which of course got the people who were teaching upset because they felt they were being attacked. But it wasn't an attack on the teachers. It was that, they're really not educators. So you have people who come from great institutions who are used to a level of being educated by sophisticated people who understand. And I don't put myself in that category. I work at it, but I'm not there. Trying to get them to understand it's what you need to learn if you want to be an educator, not that you're bad. You just haven't learned how to do it yet.
Yeah, it's the age-old problem of, we go into medicine to do medicine, and then all of a sudden we're expected to teach, and nobody's given us the skills to instruct. It's really a challenge in our profession, certainly. So if you think, and you're exactly right, sometimes there's a time for things, and just like waiting in the weeds until the time is right to implement something that you think will be transformational. Just recognizing when that is can be important. And if you need any support in that, just let us know. That's the beauty of the virtual format. We can go anywhere. Road tour.
This in particular, I have a resident who might dive on this immediately and want to make it a project of her own. So, I have one person in particular who I could bring this to and say, do you want to help me? I.e., do you want to do this? Because I have a bunch of other things I'm doing, but this, right. I could bring this presentation to her, let her sit and watch it. And she's, only a second year, but really, really, shows herself to be a powerhouse. You can just see it. So even if it's not this year or next year, that sort of thing.
Great. It's great to collaborate with the people that are running, then you're going to get more buy-in from your residents if you have a resident who's helping to run it, for sure.
Yeah.
And if they're the ones like prompting them to fill out the statement form, then
Right.
you get a little bit better response rate too. We've also adopted that strategy.
Oh, good. I was laughing when you said someone who suggested that before, to say, let's get the, was that Celeste? Let's get the attendings involved. Whoever said that, I'm like, oh yeah, that'll work real well. I could just see that now.
All right. Any other closing thoughts, you guys? Anything else you need?
This is really great. Thank you for sharing the curriculum.
Thank you for coming. I know it's a Friday afternoon. It's like the end of the day. This is like the core crew. We really appreciate you sticking with it and being so engaged. Thank you.
Thank you so much for coming.
Thank you also. I really appreciate it. Thank you.
Thanks, Dr. Dean. I want to hear how it goes at your institution.
I'll try and let you know.
Okay, great.
All right. Bye-bye.
Thank you, Amanda, for running the tech. As always, you're so great.
I'm just getting out of the meeting.
I know. Congrats.